Yeah.
My name is Florence Gutierrez. I'm a senior associate here at the Annie Case Foundation. And this is the first of several webinars that we have put together for you all to help support you in the release of the upcoming Race for Results report in October. This webinar is really intended to provide you all with a better understanding of children in immigrant families, who they are, where they come from, where they live, as well as provide you all with resources that are available to you all so that you can obtain a better understanding once you get back to work. We'll be hosting a framing webinar on September 19th where you will learn how to effectively communicate the data that's presented here and elsewhere. So please tune in to that webinar as well. I just posted the information on KidsNet, and Debbie will be sharing the information with partnership folks soon. Today we have with us Ji Zhang and Randy Capps from the Migration Policy Institute. Randy Capps is the Director of Research for U.S. Programs at MPI, and he is a leading national expert on the demography of U.S. immigrant population. With him, Ji Zhang is the Associate Policy Analyst at MPI. Her research focuses on demographics of immigrant groups, families with children, refugee integration, as well as unauthorized immigrant populations. So with that, I'd like to welcome them both. I'd like to thank them both, and I'll turn it over to Randy to get us started.
Yes, hi. Well, thanks, Flo. Thanks very much for that introduction, and welcome to everyone on the webinar. We are going to take a demographic tour of children in immigrant families. I think it's really great that the foundation is putting the emphasis on children in immigrant families right now. As all of you know, there's been a big change in the environment for immigrants and their children and immigrant integration generally. And we're not really going to talk about that in our prepared remarks today. We're just going to focus on the facts and figures. And, you know, here at MPI, a large part of our mission is to provide as reliable and accurate and unbiased information we can. That said, both of us, both G and I, will be available to answer questions, and if we want immigration and immigrant integration issues, we'd be happy to talk about them at that time.
Thank you. Please stand by.
So
you will now be placed into conference. This conference is being recorded.
We're actually getting some other activity going on the phone here. Okay, I think that's cleared up. So anyway, with this, I'm going to turn it over to G, who's going to present the findings in the presentation, and then at the end we'll take question and answer. So G.
Thanks, Flo and Randy, for the introduction, and thank you all for joining us. So for today's presentation, I will start by introducing the general landscape of immigration in the United States, looking at the population size, growth, and recent trends. Second, I'll focus on the socio-demographic characteristics of children of immigrants and children of unauthorized immigrants, and compare how they are faring to children of natives at the national level. Then I will show how these characteristics vary by state. And lastly, I will introduce the MPI publications and data tools that might be relevant for your work. Today, the number of total foreign-born population of the United States was 43.3 million, a record high in history. Immigrants represented 13.5% of the U.S. population in 2015, up from 5% in 1970, but still below the highs between 14 to 15% during late 19th century and early 20th century. Note that there is some undercount of the foreign-born population in the census data, so the actual number could be as high as 46 million and 14 or 15% of the total population. It is projected that by 2065, immigrants will account for 18% of the total U.S. population. Before we dive into details, I'd like to go over some basic definitions. We use foreign-born and immigrants interchangeably to refer to individuals who are not U.S. citizens at birth. We disaggregate immigrants into 4 groups here. They are lawful permanent residents, naturalized citizens, unauthorized immigrants, and legal non-immigrants. Legal permanent residents are admitted through family ties. For example, their parents, spouse, or children of U.S. citizens, employment channels, as well as refugees or asylees, and several other smaller categories. The United States admit around 1 million of new LPRs every year, and about 60% came as family members. Half of the new LPRs have already been here, and the other half are new arrivals. Unauthorized immigrants are those who entered the United States without authorization, often by crossing the southwestern border with Mexico or overstay valid temporary visas. About 40% of the unauthorized population are visa overstayers. Naturalized citizens are those LPRs who meet the years of residence requirement and have passed the citizenship test. Legal non-immigrants are individuals who are in the United States legally on a temporary basis, such as students and temporary workers like H-1B visa holders. Children of immigrants, which is the focus of this presentation, refers to children under 18 reside with at least one foreign-born parent, regardless whether the parent is in the country on a short-term or long-term basis. In 2014, about 11 million, or 1 in 4 immigrants, is unauthorized. Another 40% were naturalized citizens, followed by 29% of LPRs and only 4% of temporary immigrants. Legal status composition of immigrants in the past decade has shifted to more legal immigration. 10 years ago, the unauthorized share was 30%, and naturalized citizens only represented 31%. In the past decade, there are several significant trends in U.S. immigration. First is the stabilization of the unauthorized population. The population size has remained at around 11 million since 2009 due to a combination of slowdown of new unauthorized immigration and deportation. Border apprehensions at the southwest border dropped from over 1 million before the recession to around 400,000 in fiscal year 2016. Note that the uptick in fiscal year 2014 is due to the inflow of unaccompanied minors and family units from Central America, that is El Salvador, Guatemala, and Honduras, seeking protection in the United States. In the meantime, apprehensions of Mexican migrants, who used to be the majority of the total, have been decreasing to the lowest point in nearly 50 years. According to data for the first 3 quarters of 2017, the apprehension is further down and the monthly number is less than half of 2016. The second trend here is a shift in the country of origin of the foreign-born population, with more Asian, Central American, and African immigrants. In 2000, more than half of U.S. immigrants have come from Latin America. Mexican migration has been the biggest group in legal migration and predominantly in unauthorized migration. But the Mexican immigrant population, both legal and unauthorized, has declined slightly since the recession of 2005 to 2007. In 2015, their share of all immigrants dropped to 27%. In the meantime, the number of immigrants from China and India have been increasing, in part due to flows of students and temporary workers like H-1B holders, but also due to family-based migration. In 2013, China and India, overtaking Mexico, become the top source country of recent immigrants to the United States. Looking ahead, if current trends continue, Asian migration is likely to surpass migration from Latin America. Migration from Africa, although still small in size, experienced the most growth. Considering the high fertility rate in the region, we are likely to see a big increase in migration from Africa in the future. The third trend is the improvement in educational attainment of immigrants. This bar chart shows the share of four-year college graduates among immigrant and U.S.-born adults in 2000 and 2015. And immigrants from almost all regions showed substantial educational gains during this period, and a large share of them are more educated than the native-born. Even for original groups that have historically been low educated, like Mexican and Central American immigrants, there is some improvement. The slight decrease in educational attainment for those from Africa has to do with the changes in the population from mostly professional workers to a mix of refugees, diversity visa holders, and other workers. As the country experienced increased level of immigration, number and share of children who come from an immigrant background is also on the rise. Today, 1 in 4 U.S. children lives in an immigrant family, compared to just 4% in 1970. The vast majority of children of immigrants are U.S.-born citizens. The citizen share is highest for the youngest children because they're more likely to have born in the United States. Teenage children are more likely to be foreign-born. Many are new arrivals. For instance, most of the Central American unaccompanied minors are between the age of 12 and 17. This has implications to schools with large presence of late arriving students about how to quickly integrating them into the school system. Around 5 million, or 30% of the children of immigrants, lived with at least one unauthorized immigrant parent. Most of children of unauthorized immigrants are still U.S. citizens, although they are less likely to be so than the overall children of immigrants. About 19% were unauthorized themselves, and 2% were LPRs or temporary immigrants. Children of immigrants, especially those with unauthorized immigrant parents, were more likely than the children of natives to be in low-income families, defined here as family income below 185% of the federal poverty line, and be eligible for free or reduced price school lunches. Free and reduced price school lunch is a universal benefit, and there's no legal status requirements. Children of immigrants are also more likely than children of natives to be in two-parent families. Living in a single-parent family has been linked to poor outcomes in test scores, educational attainment, and behavior and psychological problems. Data here suggests a substantial advantage in these areas for children of immigrants. However, the fact that they were also more likely to be low income indicates their parents are usually employed in low-wage occupations. Children of immigrants are less likely to have parents who graduate from college compared to children of natives. Notably, even though there are more high-skilled immigrants today than 10 years ago, a lot of the highly educated immigrants are here on temporary visas, so they are less likely to have children here. Plus, longer years of education generally delay childbearing. Thus, the educational gains of the immigrant population hasn't translated into higher parental education level for children of immigrants. Roughly 1 in 4 children of immigrants was linguistically isolated, defined as living in households where no one ages 14 or older spoke English very well. Children of unauthorized immigrants were much more likely than children of immigrants to be linguistically isolated. For both groups, rates of linguistic isolation declined as they aged, since at older age, the children themselves often speak English. Linguistic isolation represents an important risk factor for child development, as parents without strong English skills generally fare poorly in the U.S. labor market and have difficulty navigating institutions such as public schools, preschool programs, and health and social service providers. English proficiency can have a significant and enduring impact on children's school performance and later socioeconomic status and integration into U.S. society. Children of unauthorized immigrants are more likely to be limited English proficient, refers to persons ages 5 and older who reported speaking English less than very well than children of immigrants. Rates of LEP declined for older children, but remain constant at older age. A fact has to do with inflows of new arriving children with limited English skills. Beyond family income and English proficiency, there are several challenges children of immigrant families faced within the United States. Compared to children of natives, children of immigrants were more likely to live in rented houses. They are also more than 3 times as likely to live in crowded housing, defined as more than 1 person per bedroom. Crowded housing has been linked to a number of risk factors for children's well-being and development, including sleep deprivation, transmission of diseases, and increased household stress. Children of immigrants were also twice as likely as children of natives to lack health insurance. Education institutions and public benefit programs usually buffer the effects of poverty and reduce the risks faced by children in low-income families. Since close to 90% of children of immigrants are U.S. citizens, they are eligible to receive a set of government assistance. Enrollment in preschool can help offset some of the income, English language, and parental educational and status disadvantages. However, young children of immigrants were less likely to be enrolled in preschool than children of natives. They were almost as likely as those of natives to receive food stamps, despite being much poorer. Some of it is related to parents' reluctance to sign up for such programs, fearing potential immigration consequences. Children of immigrants are much more likely to get their health insurance through public programs only, mainly Medicaid and the state Children's Health Insurance Program. But eligibility for these programs varies by state, and many legal and unauthorized children are ineligible for these programs. States like California, New York, Illinois, Massachusetts, and Washington, D.C. have passed bills to provide medical coverage to low-income unauthorized immigrant children. These efforts have improved their access to health insurance generally. Then we'll move forward to examine state variation. This heated map shows the growth rate in foreign-born population by state from 1990 to 2015. Although the 6 traditional destination states, California, Illinois, Texas, Illinois, Florida, New York, and New Jersey, accounted for close to 2/3 of immigrants, they are not the states with the fastest growing foreign-born population. Most rapid growth occurred in the Southeast and Nevada. North Carolina has the fastest growth rate, followed by Georgia, Arkansas, and Tennessee. Note that despite rapid growth, many still have relatively small total immigrant populations. These new destination states also experienced the most growth of the children of immigrants during the same period, and their growth rates are higher than the overall immigrant population. For example, in North Carolina, the growth rate is close to 700%, followed by Georgia, Tennessee, and Arkansas, or about 500%. There is also substantial variation in the origin group of the foreign-born population by state. Although Mexican immigrants were 27% of the total immigrants nationally, their shares were much higher in the Southwest and mountain states, accounting for more than half in Texas, Arizona, and 70% in New Mexico. On the other hand, in the northeastern states, their shares were much smaller, where the country of origin tended to be more diverse. Asian immigrants accounted for 82% of immigrants in Hawaii and close to half in Alaska and Michigan, while a third of immigrants in Vermont were from Europe. Depending on the size and how established these immigrant communities are, children of immigrants represented varying shares among the total child population. For example, in California, 1 out of 2 children lived in an immigrant family. The ratios were around 38% for New Jersey and Nevada, while in states like West Virginia and Montana, children of immigrants were around 3% of the total child population. This final map shows the share of children of immigrants in low-income families. Similar to all children, those resided in southern states are the most at risk. These states also tend to have less generous government assistance programs, while those in New England and DC metro areas were better off. Lastly, I would like to go over some MPI publications and data tools that might be useful for you to work with this population. First is a fact sheet on the demographics of children of unauthorized immigrants. We also provide estimate of this population by citizenship status and school enrollment at state and county level. We also worked on a comprehensive report looking at the demographics and socioeconomic profile of the close to 1 million young children of refugees. For your work related to English language learners, we compile these 2 fact sheets to provide information on the number of ELLs by state and school districts, as well as the top languages spoken. Now, I will leave this presentation slides and show you how to navigate our data hub, which houses a series of interactive data tools on U.S. and international migration. And specifically, I wanted to show you 2 tools that offer the most up-to-date data on children of immigrants at state level. At the Data Hub webpage, you can see different kinds of content, including the general profile of the immigrant and the unauthorized immigrant profile, population by state. You wanted to scroll down and go to the U.S. Immigration Trends section, and click on the Children in Immigrant Families, and that takes you to the first data tool. And if you click on here, this tool shows the number and share of children of immigrants among the total child population by age group and state in 1990 and 2015. You can select age group from the drop-down menu here and select your state to see what share of the child population live in immigrant families and their nativity. If you're interested in downloading the data, just scroll down and click on Get Data, you will get comprehensive data files. And then the second tool is the one about English language learners. This tool combines Department of Education data on the enrollment of K through 12 English language learners by state and the share of children of immigrant families from Census Bureau. You can sort the states by the number of EILs enrolled, and you can also sort states by the EIL share of the total student enrollment. So you can see that in California, a quarter of the total enrolled students are English language learners. That's it for the demonstration. Please take us back to the slides. Okay, that is all for my presentation. Thank you for joining us. Randy and I are happy to take questions and looking forward to the comments you might have.
Great, thank you so much. We had a couple questions come in through the chat. If you have additional questions, please go ahead and include them there as you hear the questions I'm about to ask. So one question came from Leslie Wells. Her question is, do we have rankings on states that have seen a foreign-born growth rate?
Yeah, we do have the rankings. We have that in the map in this slide. Yeah.
So do you have the data available on your website?
We have it in Excel, don't we?
We don't have it on our website.
Okay.
Yeah, but if you're interested, we're happy to please be in touch with us, and we're happy to respond. Great.
Yeah, and the final slide has the contact information for G, as well as Randy. So if there are data that you saw in the presentation, or if you have questions, you should feel free to reach out to them directly. And Terry Haven asked if we are going to be sharing the slides, and we'll be sharing the slides along with the recording of the webinar with everybody after the webinar is over. So please keep your eyes out for that on KidsNet, as well as on the partnerships website. Another question. You mentioned that you had a slide there that talked about receipt of public benefits. Do you know if there are any, or what percent of those who are receiving benefits are undocumented children?
Well, this is Randy. That depends on the benefit, right? So most of the benefits that you saw in this slide, like being enrolled in preschool, it kind of depends on the program. But generally speaking, if it's a universal preschool program in most states, then children who are unauthorized themselves are going to be able to enroll in those programs. And the same is true for Head Start. I mean, there's even a migrant Head Start program. There are even Head Start programs that really work very closely with Latino and sometimes unauthorized immigrant communities. When it comes to SNAP and food stamps, it's a little more complicated. So as G mentioned, about 80% of the children with unauthorized parents are U.S. citizens, and they are eligible for food stamps. That other 20% who are unauthorized are not eligible for food stamps. And the parents, if they are mostly going to be unauthorized, so they're not, although our data suggests that maybe as many as 10 or 15% of unauthorized immigrants are married to somebody or in a partnership with somebody who's a legal immigrant or a citizen. So the way it works with food stamps is that if any individual in the household is eligible, the family can get the benefits, but they're prorated. In other words, if you had two unauthorized parents and an unauthorized older child and a U.S. citizen younger child, then only 1 in 4 people would be eligible. So the benefits would be, they're probably not exactly a quarter, but they're prorated in that kind of a way. Health insurance coverage is a little bit more complicated. It's an individual benefit, so it's not like, you can slice it up by the number of people in the family who have a different legal status, but it's different policies in a lot of different states, right? So in some states, kids have to have been in the country with a green card for 5 years. In other states, they just have to have a green card, regardless of how long they've been in the country. Refugees are eligible everywhere. And then in some states like California, in Illinois, and New York, they actually cover unauthorized children with health insurance coverage. So there's a lot of variation by state in that indicator. I think G showed you the prior slide or two that the share of the share of children of immigrants that are uninsured, while twice as high as the share of all of children of the U.S. born, 10% versus 5%, still pretty low. And I do think that's an area where there have been a lot of gains made recently through more and more states adopting Medicaid and CHIP during their first 5 years of lawful residence, first 5 years of the green card, and in some of those programs that also ensure the unauthorized. And of course, then we have the Affordable Care Act, which has helped close a lot of health insurance gaps as well. And actually, I should add, for purposes of the Affordable Care Act, both children and adults can get subsidies for their health insurance coverage through the state exchanges, provided they're lawfully present. And that includes all the green card holders, as well as those temporary categories like students and H-1B workers that G mentioned.
Great, thank you. And another question that has come up is around if there are any data that look at what contributions immigrants have made to the U.S. economy, if there are any data available on that. Because that would sort of help make the case for why it's important that we support the families and their children.
Right. I think there's a couple of cases to be made. I'm channeling longtime demographer Donald Hernandez here, who's worked closely with many of you, I think, in the past. And what he would say as a sociologist and a demographer, and I would say from that point of view, is that a really large share of children are children of immigrants and they're future workers. So investing in them is investing in future workers. And it's not like changing immigration policy or any drops in immigration is going to affect that. They're children that are already here. Most of them are U.S. born, as we showed earlier, vast majority. And the fertility rate in immigrant families has, for the last few decades, actually been higher than it has among the U.S. born. So going forward, even without changes in immigration levels, we're likely to see more and more children having immigrant backgrounds. And it's already up to half in California and over a quarter in a bunch of other states. So those children are the future, and investment in those children is an investment in future U.S. workers, and that's sort of number one. And then as far as the contributions of current immigrants, it's not something we've studied a lot, although I've participated in a study of the economic contributions of actually two studies of economic contributions of immigrants in the state of Arkansas. One of those reports is on our website and the other is on Urban Institute's website. And we recently looked at it, well, not that recently, maybe 5 years ago in Napa Valley, California. I haven't looked at it nationally myself, and we have it institutionally at MPI, but people use a similar methodology. The reality is it's not just the jobs that immigrants do. and their productivity, but it's also their spending in the general economy that supports other people's jobs and has a multiplier effect. But at Center for American Progress, CAP has a number of these reports. Institute for Taxation and Economic Policy, or ITEP, IATEP, has a number of these studies of the tax contributions of immigrants. Oh, and I should say I missed
the National Academy.
National Academy of Sciences recently put out a very authoritative report on this.
Yeah.
Do you want to say a little bit about that?
The conclusion of it's very hard to measure the economic impact, but the panel's the result. The conclusion is, if you only looking at first-generation immigrants, and then look at they generally have positive economic impact, but then in terms of access to benefits and public resources, their kids' education, their enrollment in public schools are one of the key factors. But usually second generation, which is children of immigrants, usually outperformed, and then their tax contribution and economic contribution would outweigh that initial investment significantly.
And as some of you may know, I mean, there's currently a study underway in the federal government looking at the costs and contributions of refugees, and G and I have done some work on that as well. And I mean, refugees are kind of a special case, but I think immigrants in general follow the pattern that if they're very recent arrivals, they're going to start out near or at the bottom of the labor market and probably wind up costing a little more in public services and benefits than they contribute in taxes. And then some of the refugees and immigrants themselves will move up the economic ladder and contribute more. When they have children, as G mentioned, then they're more of a net cost. But then when those children, the second generation, age into adulthood, that's where the National Academies has found that there's the biggest economic benefit. And that ties back to my earlier point, which is that such a high share and growing share of future U.S. workers are that second generation, the children of immigrants. It's really investing in them that's most important for the future health of the U.S. economy.
Great, thank you. Lonnie had a question of how do we get people screaming to build a wall to care about children of immigrants. I don't know if you have an answer or thoughts regarding that.
Well, I mean, I think it gets back to the conversation we just had. It's about the economic benefits that immigrants bring. It's about letting people know how high a share are children of immigrants. I think it's really helpful to let people know, as G mentioned, that we're getting more on a like annual basis now, immigrants coming in from China and India in most years than we are from Mexico, and that the numbers of the estimated size of the Mexican population, particularly the unauthorized Mexican population, has actually been shrinking. And, from a border security point of view and just a demographic point of view, the wall with Mexico is kind of solving yesterday's problem because, as G showed in the third or fourth slide, we're down to 200,000. We were last year down to 200,000 apprehensions of Mexicans at the southwest border, way down from over 1 million just 5 years earlier. 10 years earlier, and that number is half that this year. So we're down more in the neighborhood of 125,000 apprehensions annually, probably this year at the pace that we're going right now. So, building the border wall is a symbolic thing. I understand it's about a feeling of safety and security and sovereignty, but it's really, first of all, not addressing where the largest flows of unauthorized immigrants are coming from. 2/3 of them now are overstaying valid visas as opposed to coming across the border from Mexico. And it's reflecting an old historic trend that's really no longer true. I don't know if that's helpful.
Great, thank you. And we had another question from Joanne. She asks, is there any data available at the national or state level on immigrant youth in the areas of foster care, the juvenile system, homelessness, and or other vulnerable populations?
There's very little on children in the foster care system. We did something about 10 years ago at Urban Institute that looked at caseloads in Texas, and they were small relative to the total population. Texas, I think, is one of the few states that has reliable data on the number and share of children in immigrant families that might be in their system. But again, it was kind of an underrepresentation. I know there are a number of researchers who've done this in some other states. I think in California, Alan Detlef, who is the Dean of Social Work at the University of Houston, comes to mind as really a top expert on this, but I haven't looked at data since then. Looking at the juvenile justice system and homelessness, I think it's harder to know. I don't think we've got a lot of expertise on that, particularly in the area of homelessness. I don't know if there are any good statistics on that topic.
Great, thank you. And then Beth had a question about how the data was framed, that it was framed negatively, and she wants to see how we can ensure to highlight the positive of the data and discuss the value of immigrants. And I think that's a question in general, and the Racial Results Report will have a focus. All the indicators are positively framed, and it will focus on the value of immigrants and their families, immigrant children and their families. And in the webinar, the framing webinar, which we'll be hosting on September 19th, we'll be talking about how we can effectively frame these data. Frameworks will be providing that webinar. We've also invited Tara from Colorado to talk about how she is framing the work in her state, and to have a conversation of what framing will and will not work at the state level. So that is something that we're planning on in the upcoming webinars. So right now, I don't see any additional questions. I wanted, where's the final slide? Sorry. So I just wanted to end with what's coming next. Again, August 21st, towards the end of this month, we'll be hosting a webinar that looks at how to effectively engage stakeholders. We'll be inviting the Burns Institute and the Center for Public Policy Priorities, who has worked in partnership with United We Dream in Texas, to talk about how to do effective stakeholder engagement. September 19th, 2 o'clock, we'll be hosting a webinar on framing, so put that on your calendar. It'll help you think about how you should frame these issues in your state. October 4th, we'll be doing a webinar with the Population Reference Bureau and possibly others to talk about the data that are available at the national and state levels, where you can find it and how you can access it. And we're working on developing a policy webinar based on the policies that will be included in the recommendations of the report. So if there are, I don't see any additional questions in the chat box. So I'd like to thank G and Randy for their time. Thank you so much. And if you all have additional questions that pop into your head, please be sure to email me or email G or Randy. They're happy to help you with your work. Thank you.